I'm from, well, I guess you'd say Cleveland, Ohio. My concussion story is long. It began, to the best of my knowledge, 10 years old was the first time I was officially clinically diagnosed with a concussion. Though understanding it now, I probably had countless before that. We just call it splitting your head open, you know. This one was running in basketball and just getting a big foot tripping me forehead to the court, and waking up a few hours later, in the hospital. That was the first time I guess I really truly recognized like what that experience was for me, and based on my personality, I suppose, and just my disregard for personal safety. I wanted to run as fast and hard as I could at everything. I wanted to climb everything I found. I wanted to throw myself into every adventure that I could find, and in doing so, I injured myself quite a lot. I just started getting more concussions just from getting my head smacked hard by things. A lot of accidents, a couple of car accidents, just getting hit by speeding cars is pretty heavy concussions, and getting hit with a log. I'm trying to be concise here because there's so many of them, gosh, but I'm trying to highlight the more severe. Just getting like an 80-pound block of wood chipped at my forehead. That was pretty hardcore. And so by the time I was 13, I had 8 concussions. I would describe the program as a training camp of physical medicine. You're being taught everything and reinforcing all of the skills that you'll need to move forward after your time here in treatment is finished. From the start, you are in charge of your progress. It's so effective because you're taught exactly why your body is acting the way it is. You're taught why these symptoms occur, experiences how it's become so progressed, but also that it's not just treatable but reversible. You're shown the way to reset your body far better than it was before, and you will not leave without a complete understanding of the muscles in your body. You're conditioned to symptoms and being equipped with the knowledge and the tools to manage your own care for the rest of your life. And the program, it's it takes you in and gives you hope. MyoWorx versus all the other treatments I've had, how do they compare? There absolutely is no comparison from my standpoint of view, but to be brief, I've had 2 neurologists in the entire course of the time that I've gone through this. One of them just said, "You can never hit your head again or you'll die." God bless her for what she does, but not very helpful, because how do I get better? And the other one gave me medication for headaches, and I'm like, I need so much help, but all I got was, and I don't, it's not that they're bad people or poor practitioners, they just don't understand, they don't know how to help. So the best help that they could offer is what they gave, I guess. When your concussions take you to this point, it affects every system in your body profoundly. So what doctor can you go to that can address all of that? In the meanwhile, never fully understanding the logic and cause behind it, the causality of it all. I haven't had the fortune to try every treatment there is out there, but I've tried a hell of a lot. The most effective treatment I ever found was myself, and keeping my body healthy and strong as best as I could until I couldn't anymore. There's some great people out there trying their best to help, but they were all entirely ineffective. The treatment here was immediately effective, and progressively more effective, and until I forgot what it felt like to wake up every day like you got into a car accident the night before, forever. There is no other treatment that compares. There, of course, have been a few connections here, because after a certain time you realize that every single other person walking through the doors is like you in so many ways, and it's like being able to see something in each other's eyes where you know. I've talked to grandmother who just fell and had one injury, and it has been suffering, of course, for a long time, because you don't have to have 30. And talking to her just about her symptoms and just being supportive, you already have that connection. I've met and discussed this, just the immense power of this experience with other patients here, because they're as awestruck as myself, and getting to see them, over the course of the time, like bumping into them again and like, how are you doing? And they're always better. They're smiling a little more, they're standing up a little more straight. And I've seen at least one patient who was new and seemed a little timid and unsure and suffering, obviously, as we all are. But of course, this patient was clearly wearing a lot of pain and heavy burden, and sometimes all you need is a friend or someone who to say, like, I know what it's like, and to mean it, and then to have someone who you can identify with, who knows what it is, and then reach out with all sincerity, like believe in this, give everything you have into this, because it works. I promise it works. And to see them kind of shift a little bit in their disposition, like maybe try a little bit harder, or maybe just relax a little bit, because they trust that they're going to be helped, because it's scary, of course, and you're used to disappointment and being let down and failures of all kinds. So not just me, but anyone else that's encountered patients here, it's like unanimous. We all have that same thing. I know how you feel, and I'm sorry. And boy, what a miracle this is that we found this place.